Hey, how's
Um,
everybody doing tonight?
this is a quiet bunch. Annabelle will talk and ask questions. Barbara will. Uh, mm, See who else is on here. Ashley will. Ashley will. And if Logan jumps on, she'll grill you. But so as I was saying, Chelsea works for a hospital back in the Dallas Fort Worth area, and I wanted her to kind of jump on and because for those of you who aren't in healthcare yet but are getting ready to jump into it, um, she might be able to give you some insight on um, what she's beginning to see with AI. Um, and and then I've had some questions sent by a few students, and I sent those over. And I can read them, Chelsea, if you want me to, or if you want to do, I'll let you run the show from here, and you just tell me what you need.
Okay. Um, so I'll just introduce myself. My name is Chelsea Harley. I am the manager over what's called the Release of Information Department here at, it's called Methodist Dallas. We currently have 6 hospitals underneath us and bringing on a 7th. So we're pretty large throughout DFW. I do handle all 7 or almost 7 facilities and 2 clinics, medical records. I do have a team of 13 currently that do release here. And happy to be with y'all this evening. I hope y'all get something out of this. If y'all have any questions, please feel free to put them in the chat or let him know after, and I'm happy to answer questions after the fact if need be. But we'll go ahead and jump in. The first question I was given was, what are the benefits of using AI in healthcare and hospitals? So with AI can be pretty useful, especially when you're dealing with a lot of data, a lot of sets, and very large groupings of things is, what we see a lot in healthcare with AI. And our medical records, at least, we don't use it as much here. We haven't transitioned that direction, but I'm sure at some point someday we will move more that direction. But we do have a couple of things that we use AI for. One of them, we call it Gateway. Gateway is a platform that, for instance, life insurance companies will send requests to for their clients and say, we need records for them in order to prove that, this disability, this illness was not aware or there at the time or prior to the signage of life insurance. When those come in, they come in through what we call a work queue. And when we see those, they come in, we look at an authorization, we say it's good to go. The system will generate what records we have, what fall within what they've requested, and then we just hit send to Gateway, and it sends back to the company on the outside. But AI does a lot of that generation of sending it, receiving it, pushing, pulling. AI does that side. Now, in medical records, that really is the only side that we utilize AI. Because even with this kind of AI, we still have to do some of the legwork. And we'll get into that in a later question. Second question, the future of AI in healthcare. I will say it is becoming more needed, more used, more utilized throughout stuff. My company is not currently using it for things like medical billing and coding. We're not quite there. We were asked to utilize it and we denied the use of it at this time. But I do know a couple of different healthcare industries, medical and dental, that are currently using AI for the coding purposes. And if you don't know what coding is where you go to your PCP, your primary care physician, and they say you need labs, and you need labs in order to indicate whether you've got high blood pressure, high blood sugars, whatever the labs are. So once those are done, a coder will go in and say, okay, well, for these labs, we're going to charge this. So they assign a specific code to indicate the charges. So AI is able to indicate and add those codes for us. So instead of a human being doing them, that's where AI comes in, and that's why you're seeing it more and more in healthcare now, is because it can take some of those tedious jobs and do them a lot faster so that we can get paid. Hospitals, doctor's office, that kind of thing. Third question, is AI used in medical record review? So I'm sure it is used somewhere, but it is not used within the Methodist system. Within our 6, almost 7 hospitals, it is not utilized because there's too many things within medical records that are always changing. So Heath, are you good if I share my screen?
Yeah, let me do that real fast.
I have the ability to do so.
Okay, all right, yeah.
Sorry.
And while Chelsea's doing that, I can tell you that Piedmont uses something similar to Gateway, and that Northside and Northeast, they're kind of in the same boat as Methodist in Dallas, where they're on the fence if they want to use AI with any of their medical records and that type of thing, and or as far as record review. So I think all the hospitals are they're on the cusp of trying to figure out and navigate those waters.
If I can just like interject really quickly, Dr. Harley.
Yeah.
I don't know if you can hear me. So I work for a medical coding company as well, and we just merged with an AI company because we were also asked. I've been with them just for a year, but the founder's been asked for like the last 5 years if she can merge. And I do know that there are some big revenue cycle management companies that are doing the machine learning as far as coding, and then having the coders just oversee the AI. But as far as machine learning, like the more you use it, we're kind of behind the ball a little bit because we're a year out. A lot of the ED medical coding is being AI coded and then overseen by the coders. So the coders are almost becoming auditors.
Yep.
But it's here.
Yeah.
It's here. It's becoming efficient.
Yeah, I mean, it is efficient in one way or another. I think it's really on how you view it, to be honest with you, because for us, you know, it takes away from people actually having jobs. So we won't move into it till it's absolutely necessary, is our view on it right now. And we find more often than not when they tested it, is that our coders were having to go back and do more legwork because it just wasn't reading things properly on the hospital side and on our physician billing side. It just wasn't reading things properly. And like you said, the more you use, the more it learns. But it can take some time to really build those things up. So I don't know so I haven't seen anybody, sorry, one of the questions that came through the chat is just about asking if we've seen an increase in people losing jobs from AI. Not necessarily AI itself, not me personally. I can't speak to others, but I can say the more we move into the electronic age of using stuff like AI and what we call portals or systems where we upload records to, it's not as needed to have a true human being in the office full time. So I'm sure AI will take that too at some point. But there are pros and cons to everything, and it's always changing. New jobs will be created the more we use AI, or like she said, for going through and auditing what the AI has done. But moving back on to the questions, I am going to share my screen need me. Yeah. Okay. So for y'all that are not currently in healthcare, and this is a part of question number 3 I received, which is AI used in medical records review? So this is our authorization that we utilize here at Methodist. So most companies, most insurance attorneys' offices, anyone that needs records is required to have some form of a HIPAA authorization form. So we ask for a whole bunch of information, a whole bunch of data from the facility our patients were seen at, to their name, address, city, state, phone, birth date, what they're needing, or if they're needing it sent somewhere else, how they're wanting it sent. So we have a couple of different options that we provide to our patients. That's, you know, from mailing, encrypting, pickup, my chart, that kind of stuff. And then at the bottom, and the primary reason we don't use AI is this signature right here. So when signatures come in, anyone can sign this document. For Dr. Harley, I could fill this out if I knew all his data and put his name in here. I could say, yep, I'm him, this is me, I want his stuff. But AI cannot say that my signature does not match his signature. It cannot read it. It cannot say, well, this isn't the right person. His name's there because it's an electronic signature, right? So AI can't tell you that this document is missing something, which is for most companies is a photo ID, some form of identification with a picture, a name, date of birth, whatever it is, whether it's driver's license, passport, Costco card, something with your picture and your name. A lot of the times, well, when we went through AI trying to see if it was going to work, it primarily had problems with requests for patients that are deceased. Because say I passed away tomorrow and my mother wants my records, she is not legally able to obtain my records because I am married. My records fall to my spouse unless I have a living will that indicates her as the executor. So AI cannot say, well, you know, somebody signed it, but we also need these things, all these other documents, a death certificate, a marriage certificate, whatever it is that it needs to be valid. AI can't tell you those things. It's just looking, is there a signature? Is there a date? Can't say, well, her mom signed it. They don't know who my mom is. It's a computer. But that's what human beings are for. We come in and we say, okay, Karen signed this instead of Ryan. So we say deny, right? So that's a really large reason that we don't use AI here, because HIPAA is still, you know, the same as pretty much it's always been. Some things change and grow like everything else, but a signature is always required either from the patient, their next of kin, or their executor on their will. So that's a large reason that we don't utilize it here. Number 4, do you use AI? Like I said, we use it very minimally when it comes to releasing. The only time we do is with Gateway, and even within that, it is still us going in, looking at the authorization that was provided by the patient, and looking at all the documentation that the Gateway sent over, and we only use it for life insurance. But when they send that over, we have to make sure all the required documentation is there. It's saying what they need it for, where it's going is already, you know, set in stone because of AI. But we need those signatures, those dates, the IDs. We need all of those things. So yes and no. We use it on some sides, but not the others. Now, using AI, I did talk to somebody in our billing department. So our coding team does not use it, but in our billing department, they do utilize it some for reporting and pulling large amounts of data on the billing side to see, you know, how many mistakes were made, how many things didn't get coded properly, and stuff like that. So it is being utilized in our hospital system, and it is continuing to grow with the use as we move along, but it just hasn't touched all of the areas as of yet. The fifth question, is there a hospital section that does not use AI? There are a lot of sections in healthcare that do not use it yet. So transcription is when a doctor calls in to dictate a operative report, a consultation, progress notes. When they call in, it's recorded, and then there's somebody on the other end of the line that sits and literally types it out. At some point, could AI do this? It's likely, right? But you have to remember that AI doesn't understand accents in the beginning. If you have an accent, then you know it could take a while for AI to really pick up what you're saying. So we don't use it in transcription as of yet. Coding, like I said, on our side, we do not use it, but I do have a friend that does. On their end, they do utilize coding for, it's in dental insurance, but we do not use it in the medical records department at all for my section, which is release of information, or there is one other section of medical records. It's called record processing. So it's where we take records that are in paper form and scan them into our EMR system, and they make it electronic. We still have to manually go in and tell the computer, tell the EMR system what that report is. It still cannot read that it's a consent form or that it's a progress note or a history and physical. It still cannot tell them that, because sometimes it's handwritten, and I don't know if Dr. Harley writes like all the other doctors, but you can't read it. If any of y'all are medical billing encoders, y'all might have seen how a doctor writes, and it's a bunch of scribble, and AI can't read it. So they're not utilizing that either as of yet. Registration, the registration department is not utilizing that. I don't know if that would ever become a thing for registration, and that's when a patient comes in and we take their name, date of birth, their insurance, all of that kind of stuff. I don't know that registration will ever take that on, or AI will ever become into registration, but you never know. People are really smart. So last question I got was, have I ran into anybody that carries a health informatics degree or has a job in health informatics? So the jobs that we see with this degree actually work within our EMR. So if you don't know what an EMR is, it's an electronic medical record. So we utilize Epic. Has anybody ever heard of Epic or utilized Epic? If so, you can put it in the chat. But we utilize that on a in our system. We do utilize other EMRs like Meditech, PaperVision. They're really, really old, so most of you probably don't know what those are, but we do utilize those, and we actually still have paper charts from the 1990s. So those were never made electronic. They're still in paper form in the basement. But we see a lot of people in our Epic team, in our EMR team, that have this degree, because with Epic, it's, let me see if I can pull up, hold on. I want to show y'all. we have a play system that I might be able to show y'all a bit. But within Epic, there's a lot of building, a lot of changing, and a lot of data that can be pulled from Epic in order to help us, you know, process faster, pull the right data. So for instance, why did that not work? We have doctors that, for some reason, it doesn't want to work today. Okay. But we have doctors that go from our hospital and then they want to go work for Baylor. Okay. When they do that, they have to come to us and say, we need our case log for the last 2 years of every surgery I've ever done. And Epic helps us by running all of that data in one go. We don't have to go in and do anything but enter the doctor's name and the date range. Epic will do it for you. So health informatics can be utilized in multiple different things, but within healthcare, with the Epic side, you would be the one that helped go in and build those reports, build that data together in order for it to transition somewhere else. So I had our Epic team build me a report that pulled every release that we listed as an attorney request. They went in and said, okay, this box, and this box have been met, and they built that report for me. So it would pull all the data that I wanted into one singular place. So we see it a lot within that. So let's see, I think there was one other place. Yeah, just primarily in IT, but with the Epic side. Could it be utilized elsewhere, like in care management? Most likely. Care management does a lot with reporting. Quality, you could see that a lot in quality as well. Quality deals with the reporting for infectious diseases, any Texas Health and Human Services, or I don't know what Georgia's is called, sorry. But a lot of their data, and they push it out or pull it in from elsewhere to see if our sepsis numbers are, you know, higher than another hospital around us. So it can be used in a couple of different job placements within healthcare. So I wouldn't be worried about that side of it, because it can be used in a few different places. But those are the questions I received, I was sent. Does anybody have any additional questions they'd like me to answer?
Hello, Chelsea. My name is Hannah. I work for a healthcare organization, and just to piggyback on what you said, when we first implemented Epic, it was set for the system to take the level of service for the office visit, and it was just gathering words such as family history, social history, or diagnosis, and it ended up being the wrong level of service, so we had to turn it off because, like you said, it's at the end is more work for the coders to go and clean out everything.
I'm sorry, you sound really muffled. Say that one more time.
I'm so sorry, can you hear me better?
Yes, I can. Thank you.
Sorry. No, I was just saying that when we implemented Epic in our organization, we had it selected the levels of services for the office visits. So we ended up finding out that it was picking the wrong level of service because it was just selecting words out of the notes, which didn't really make reference to the actual level of service. So we turned it off.
Yeah, so we have seen that some as well within the testing time frame that we did, and that's a really large reason we decided not to utilize it, was because it could not indicate the overall level of service or what we really needed it to. It just random word grabbed, and then it was like a hope and pray that it was right, or we spent more time going back in and changing everything to what it really needed to be. So it was a waste of time in the end of the game.
Anybody else?